Feeling dizzy after your blood pressure medication? If you're over 60, you might think it's just aging. But dizziness is one of the most overlooked warning signs of BP pills, and your body may be telling you something important. In this video, I'll explain why dizziness happens with blood pressure pills after 60, which medications cause it most often, and when it's a harmless adjustment versus a sign you should not ignore. Just a quick note, this video is for general education only. It doesn't replace medical advice from your doctor. Always talk to your healthcare provider before changing any medication. When people describe dizziness, many assume it means weakness, or that something is wrong with the brain. But in most adults over 60, that's not what's actually happening. What you're feeling is usually a temporary change in blood flow. When you stand up, gravity pulls blood down toward your legs. Your body has to respond quickly by tightening blood vessels and slightly increasing heart rate, so enough blood keeps flowing to the brain. In younger adults, this adjustment happens almost instantly. But as we age, that reflex naturally becomes slower. So, for a brief moment, blood flow to the brain can dip, just enough to cause lightheadedness, a floating sensation, or mild unsteadiness. This doesn't mean your brain isn't getting blood overall. It means the timing of that adjustment is delayed. And that short delay is what creates dizziness. Not damage, not weakness, and not loss of control. That's also why the sensation often improves once you pause, steady yourself, or give your body a few seconds to catch up. Now, blood pressure medications don't create this problem, but they can make this normal adjustment more noticeable. Blood pressure medications are not doing anything wrong. In fact, they're doing exactly what doctors prescribe them to do. They relax blood vessels, they lower pressure inside the arteries, and they reduce the workload on the heart to protect the brain, heart, and kidneys over time. But there's an important detail most people aren't told. Because these medications relax blood vessels, blood pressure can drop a little faster when you change positions, especially when you stand up. That drop is usually brief, and it doesn't damage the brain. In adults over 60, however, that faster drop can temporarily reduce how much blood reaches the brain during that transition. That short delay is what creates dizziness. This isn't a medication problem. It's an age-related reflex becoming more noticeable. Doctors see this pattern with several common blood pressure medications. Calcium channel blockers, which relax the walls of blood vessels, ACE inhibitors and ARBs, which affect vessel tone and fluid balance, and diuretics, which reduce excess fluid and lower blood volume. These medications don't create a new issue. They simply highlight a normal change in how the body adjusts blood pressure with age. As we get older, blood vessels don't tighten as quickly when we stand up. The nervous system response becomes slower. So for a brief moment, blood pressure can dip more than it used to. Doctors call this orthostatic hypotension, a drop in systolic blood pressure of about 20 points or more within a few minutes of standing. That drop can slightly reduce blood flow to the brain, just enough to cause lightheadedness, a floating sensation, or mild unsteadiness. Not because the brain isn't getting blood overall, but because the timing of that adjustment is delayed. Medication timing can also play a role. Doses taken at night or during natural morning blood pressure dips may make these brief drops more noticeable during daily activities. That doesn't mean the medication is wrong. It often means the schedule needs to be fine-tuned. Mild dizziness that appears right after standing and clears within a few seconds is often expected at this age, especially when blood pressure stabilizes quickly. Doctors start paying attention when dizziness lasts longer than 1 to 3 minutes, worsens with activity, comes with blurred vision, near fainting, confusion, chest discomfort, or leads to falls. Simple checks, like measuring blood pressure while sitting and then again after standing, help doctors decide whether anything needs adjustment. The key point to remember is this: blood pressure medications are protective. They don't cause damage. They simply make a slower, age-related reflex easier to notice. And when doctors recognize that, the focus is on safety, timing, and balance, not stopping treatment. Now, there are a few specific situations where dizziness deserves a closer look. Not because something bad is happening, but because this is when doctors start paying attention. The first is dizziness that happens right when you stand up. Many people feel a brief wave of lightheadedness for a second or two. That can be normal. But if the dizziness lasts longer, feels stronger, or happens repeatedly throughout the day, that's different. It suggests your blood pressure is dropping more than expected during position changes, and this is when doctors start paying attention. The second situation is dizziness that comes with blurred vision. This isn't about weak eyesight, and it's not an eye problem. What's happening is that blood flow to the brain and the visual centers isn't fully stable for a brief moment. The eyes are usually the first place you notice that change. If dizziness and blurred vision appear together, especially during standing or walking, this is when doctors start paying attention. The third situation is dizziness that comes with a near fainting sensation. That feeling of, I might pass out, even if you never actually lose consciousness. A sudden weakness, a need to grab onto something. This often reflects a faster or deeper drop in blood pressure, and in adults over 60, that matters. Not because of harm to the brain, but because of fall risk. This is when doctors start paying attention, so they can reduce the chance of falls and injuries. In many older adults taking blood pressure medications, these episodes are linked to temporary drops in blood pressure during movement, especially when standing, bending, or walking after sitting or lying down. Age-related changes slow the body's ability to tighten blood vessels quickly. Medications that relax vessels or reduce fluid can make that delay more noticeable. Most mild dizziness that clears within seconds is expected, but when it lasts more than 1 to 3 minutes, worsens with activity, includes blurred vision or near fainting, or starts interfering with daily life, doctors want to evaluate it. Often, the solution isn't stopping medication. It's adjusting timing, dose balance, hydration, or posture habits. The goal is stability, safety, and helping your body adapt smoothly, without fear. This type of dizziness is often brushed off as just getting older, and there's a reason for that. As we age, balance naturally changes. Reaction time slows. Circulation doesn't adjust as fast as it used to. So when lightheadedness shows up, many people, and sometimes even caregivers, assume it's simply part of aging. But here's the important part. Age alone doesn't usually cause sudden dizziness. It creates a slower adjustment system. When blood pressure medications are added, that slower system becomes more noticeable. Not harmful, just more obvious. The combination of age-related changes and medication effects can feel like weakness, or like the body is declining. In reality, it's the body responding differently than it did at 40 or 50. When you understand that difference, something changes. Instead of ignoring symptoms or blaming yourself, you start paying attention in a useful way. Understanding what's really happening makes you safer. And it gives you confidence, not fear, about how your body works after 60. Here's what I want you to remember. Dizziness does not mean you're weak. It does not mean your medication is wrong. And it does not mean something is failing inside your body. Most of the time, it's simply how your body is adjusting blood pressure. A little slower, a little differently, as you age. When you listen to those signals, instead of dismissing them, you stay more stable, more confident, and more in control. And that's what living well after 60 really looks like. Knowing what's behind the dizziness is helpful. Now let's talk about how to explain it to your doctor in a way that leads to real answers. When you talk to your doctor about dizziness, the most helpful thing you can do is describe the situation, not just the symptom. Instead of saying, "I feel dizzy sometimes," try to explain when it happens. For example, "It usually happens when I stand up," or "I notice it a few minutes after taking my medication," or "It feels worse in the morning than later in the day." These details matter. Doctors are listening for patterns, not complaints. It also helps to describe how long the feeling lasts. Does it pass in a few seconds? Does it stay for a minute or two? Or does it linger long enough to affect walking or balance? You don't need medical terms. Simple words are enough. Lightheaded, unsteady, a floating feeling, needing to hold on to something. If you've checked your blood pressure at home, mention that too, especially readings taken while sitting and then standing. And one more important point. You don't need to say, "I think my medication is wrong." Instead, you can say, "I want to make sure the timing and dose are right for me." That shifts the conversation from stopping treatment to adjusting it safely. When doctors hear clear, specific information like this, they can make better decisions, often with small changes that improve stability and confidence. And that's the goal. Not fear, not guesswork, just clarity and safety. Many symptoms after 60 are often brushed off as normal, and some of them truly are, but others are your body's way of asking for attention. Not alarm, just awareness. In the next video, I'll help you clearly tell the difference between what you can safely ignore and what's worth bringing up with your doctor. Because most problems don't come from the pill itself. They come from how the pill is used. I'll see you in the next video.